If you just found out you have high blood pressure and you're thinking, I feel fine.
I'll do it later, dear, I promise.
This video is for you. Hi, I'm Dr. Brian. Because here's the truth. High blood pressure doesn't wait. And in just 1 year, it can quietly damage nearly every major organ in your body without a single symptom. I get it. No chest pain, no headaches, no dizziness. It's easy to think high blood pressure isn't a big deal. You don't have any symptoms. You haven't been to the emergency room. So what's the harm in waiting, right? Well, behind the scenes, high blood pressure is doing real damage. And that damage adds up fast. Today, I'm going to walk through exactly what happens inside your body after just 1 year of uncontrolled high blood pressure and why this, if it's your first year, is the year to take it seriously. In this video, I'm going to show you exactly what happens organ by organ so you can decide whether waiting is really worth the risk. Let's start with the first target. Your heart is the first to feel the pressure. Literally, your heart is a muscle, and when your blood pressure is high, your heart has to work harder just to push the blood through those stiff, narrow blood vessels. That extra work causes the heart's main pumping chamber, which is known as the left ventricle, to get thicker. You might think that sounds strong, like building muscle, but in this case, thicker doesn't mean better. And it actually makes your heart worse at relaxing between beats, which is really important. And it increases how much oxygen your heart needs. And it raises your risk for very irregular heartbeats. This is known as an arrhythmia. It also makes you prone to what's called heart failure, even if the heart seems to be pumping normally, and sudden cardiac death. This thickening is called left ventricular hypertrophy, or LVH, and the American Heart Association clearly says LVH is a strong warning sign for future heart attacks, strokes, even if your cholesterol is perfect. Next, how about your arteries? They're supposed to be like flexible pipes, but after a year of high pressure running through them, they start to stiffen and get damaged. Your large arteries, like the ones that go to your heart and your legs and your kidneys, those become less stretchy and more prone to dangerous problems. Again, like heart attacks, blockage of blood flow to your arms, to your legs, to your kidneys, and the blood vessels can develop what are known as aneurysms, which are weak spots in the blood vessels that can balloon or even burst. And it's not just the big vessels. The tiniest ones, especially those feeding your eyes, your kidneys, and your brain, those start to break down too. They lose their normal shape, they get inflamed, and scar tissue starts to replace their healthy linings. You won't feel this right away, but it reduces the blood flow to your necessary organs, and it lays the groundwork for much long-term damage. Next, the kidneys. They may be the most silent victims of all. See, your kidneys are like high-tech filters. They clean your blood 24 hours a day, 7 days a week, 365 days a year, no vacations. And they're full of tiny, delicate blood vessels. And high blood pressure damages them slowly and quietly. Over time, the little filters called glomeruli start to scar and clog. At first, your only sign might be small amounts of protein leaking into your urine. And you only find this if you get a very specific lab test. But as the damage builds, your kidneys lose the ability to filter waste. That leads to swelling of your face and your arms, your feet, your legs, just overall fatigue and tiredness. And eventually, you can get chronic kidney disease and even require dialysis. And in fact, high blood pressure is one of the 2 top causes of kidney failure in the United States, second only to diabetes. Let's move to your brain. High blood pressure quietly injures both large and small vessels in your brain. High blood pressure doesn't just raise your risk of big, obvious strokes, it also causes small, silent injuries, tiny areas of damage that builds up over time. In small vessel disease, there are tiny blood vessels deep in the brain that become damaged. This causes white matter changes, mini strokes that you don't feel, but over time, these stack up over and over, and you can get memory loss and confusion. Then there's the large vessels. This is the bigger arteries that can clog, tear, or burst. This leads to major stroke strokes. Strokes like you think about, where you can't speak, you can't walk. And when your blood pressure is too high for too long, your brain loses its ability to protect itself from sudden spikes or low blood pressure. And you can have significant problems with your brain if the blood pressure changes for any reason. Now let's zoom into your eyes. Your eyes might actually be the first place a doctor can see the high blood pressure damage. The retina, which is the light sensitive layer at the back of your eye, has many small blood vessels. And when blood pressure stays high, these vessels start to narrow, they start to leak blood, they start to show signs of blockage at the vessel crossings. And in severe cases, there can be swelling around the optic nerve, the main nerve in the back of your eye. This is called hypertensive retinopathy, and it can lead to vision problems and even blindness. But here's the key. What your eye doctor sees in the retina often mirrors what's happening in the brain, your heart, and your kidneys. It's like a window into your overall vascular health. Now, this collection of changes, heart thickening, artery stiffening, kidney scarring, brain injury, eye vessel damage, it's what doctors call hypertension-mediated organ damage, or HMOD. It's not something you have to wait years to develop. Studies show that it can start within the first year of having uncontrolled high blood pressure. And once this damage starts, your risk of stroke, heart failure, kidney failure, and early death goes up dramatically. So what should you do? Well, let's say you just got that high blood pressure reading. You don't feel sick, no symptoms. So what now? First, know your numbers. If your blood pressure is consistently above 130/80, it's time to act. Second, use a validated upper arm blood pressure monitor. At home, check your pressure regularly and write it down. Third, don't wait for symptoms. The damage starts before you feel anything. The earlier you treat it, the better your chances of reversing it. That might mean changing your diet, exercising more, reducing stress, cutting back on alcohol, or starting medication. But what matters most is doing something, because remember, it only takes 1 year for high blood pressure to start changing your body in ways you might not recover from. The good news is 1 year is also enough time to turn it around. I'm Dr. Brian. If you like this video, if it helped you understand what's going on, subscribe for some more clear evidence-based health information. Share it with someone who just got that same diagnosis. And if you want to know how to lower your blood pressure naturally, try this video and don't forget to subscribe.